Okay. EDS. Jan Skimming will take you first, and then Liz is going to join us. Let me unmute you, Jan. Or you can unmute if you can. I'm sure you can. I know it's hypermobility, but what is EDS? What does it stand for, and how does it manifest itself?
Well,
because the reason I want to cover this is it'll be good for everybody to understand. Well, just your own personal experience is good.
Yeah, I mean, I'm not an expert on EDS. I am hypermobile, and I have been all my life. EDS stands for Ehlers Danlos syndrome, which is the very fat end of the wedge of hypermobility spectrum disorder. I'm probably at the thinner end of the wedge, and having been, touch wood, in pretty robust health all my life, and a very fit and active person, you know, doing things like swimming and gymnastics and ballet and tennis. And as a kid, I was always very active. And even as an adult, I managed it. But what it is basically it's very loose joints, you might say. Loose, it's a connective tissue disorder. So, and the sorts of things that can happen to you I've never broken a bone in my life, but I've had a lot of trauma, lots of accidents. And I used to think, I've had another accident, but actually that is part of the syndrome. It is part of something where, because your tendons and ligaments and the connective tissue, the actual form of the body with these very lax, stringy, sort of bendy joints, you have what very poor proprioception, it's called. So you can't really sense exactly where your body is in space. I mean, I did yoga for a long time, and I was able to do it. But as I've got older and I've gone through menopause, I'm well past menopause now, 63, my next birthday, 63. And, you know, as you were saying about the collagen, you know, as you go through menopause, your collagen starts to degrade faster and becomes less soluble. And I had a big trauma a couple of years ago, and it was a multiple kind of site trauma. So it affected my knees, my hips, my shoulders, my wrists, both wrists, elbows, and shoulders, particularly on the right side, that went into my neck, and I'm paying for it now. And I've hyperextended my neck more than once, very badly hyperextended. It was misdiagnosed as an acute torticollis. It was actually more serious than that, but that was just by hyper rotating and extending to get a cat from underneath my pillow while I was in bed. So I just was lying on one side, turned my head to push Henry out from underneath my pillow, and by the time I woke up in the morning, I was lying my head on the other side. I couldn't lift my head off the pillow. I was in excruciating agony. And what happens when you get misaligned is there's a lot of potential for neuropathic pain, because nerves get compressed, and nerves don't like being compressed, and that's when you get a lot of pain. And I last year, after I was, you know, struggling with this multiple site injury thing that's gone throughout my body, after we got flooded, and then I was lifting a lot and carrying a lot of wet things, and I was tired and what have you. I just walked down the stairs about 4 days after the flood, and my back went. But my back went really badly, and I couldn't walk, and I had full-blown body sciatica, which is not something I would wish on anybody. It was excruciatingly painful, and it really got my attention, obviously, because I was in agony. I mean, happily, I stock a really good quality CBD C60, and that helped me with the pain. But then I had to get through getting my body realigned. So I've had a lot of treatment over the last 6 months. I've had treatment this morning on my neck. So for me, LV bringing out collagen was really more than timely, and I couldn't wait for it to arrive. It was like, I need this now. And it's been very interesting seeing what's going on, because I started taking it and I was doing some training over in Fife, and for a 4-day workshop it was, and I realized I was only about a week into the collagen, and I started to get what you might call a healing crisis, some sort of aggravation. And even the little finger, these little joints, you know, these joints here, my wrist, and tiny little joints in my toes, in my fingers, my wrists, my elbow, in my neck, and in my right knee. I was getting like sort of electric shock pains and aching and creakiness. And I thought, what's this? You know, what now? So I was a bit despondent because I'd started the collagen. I was thinking, oh, we need it to work. And the following week, it got loads better. It was just amazing. And I felt brand new. My joints stopped clicking and being weird. And I got my felt really mobile again. My back stopped aching. I thought, right, this is it. This is just going to ramp up. But of course, I think this is worth sort of bearing in mind with people who might go through something like this. And we know, I mean, I'm an holistic practitioner, a nutritionist and a homeopath, so I know there is no straight path to healing. It's always in cycles. It's always, you know, it's like the sea coming in. It doesn't just rush in, does it? It goes in and out and in and out and in and out as it comes in, and then it goes out and in and out and in as it goes out, you know. So there's always a sine wave, a cycle that you go through when you're healing. And then I started on my second month.
Which
so
is
I just
interesting, isn't it? It's interesting that, isn't it? Because, and that is a very good point for everybody, people who are completely unaware of that, which I would say is most people, they start on the products and they just expect an uphill journey to being great.
To wellness.
They don't realize that there's peaks and troughs along the way, and that your body has to be able to function better, and that doesn't feel too good. So it is important that people are aware of that, because that's when people say, oh, I think it's causing this, or I think it's doing this, and I'm like, just try and bear through it, because it's really important that people understand that when you're healing, it doesn't look perfect. It is messy and it can be uncomfortable.
Yeah. And the thing is that I started the second month and the same thing happened. So how interesting is that? So I had another, and I've just taken my first bottle of my third month. So I'll be very interested to see. It wasn't quite as noticeable, and it was in different joints, but it was still there, and I recognized the sensations. I thought, here we go again. And then following that, I got a surge forward. It's a little bit like we often see it when you treat children holistically. You know, you can give a generative remedy, and they'll make developmental leaps. It's like when they have a childhood disease, naturally, they'll fall back and then they'll make a few big strides forward. So it's this sort of toing and froing that I think is worth bearing in mind. So yeah,
I think that's also relevant, without any science behind it, with the digestive issues that some people have with the collagen. So some people find that it doesn't settle well with their stomach, which it did happen to me. I mean, I'm not that bothered about it, but I noticed that for the first couple of months it would come and go a little bit like that, but month 3 it's completely reversed the other way around. It's not doing that anymore, and functioning way better than it has done probably in years. But I could have quit on month 2 thinking it was causing me a problem, but knowing what I know, I'm like, no, this is good, it's probably working something out. And it has actually shown completely true in that area. And so it's important to remember this when people have stuff come up, when people say, oh, it's giving me a headache, or my hot flushes have come back, or something like that. Don't just quit using the product. There's a process that your body has to go through often, and it's not always positive.
I know we have
It's
a
positive,
thing
but it's
when
not,
you're
doesn't
looking
maybe
at
feel
how
positive.
to assess a case. We call it the direction of cure, and the direction of cure is from above downwards, from inside outwards. So it's centrifugal
Yeah.
in force. So from organs of greater importance to organs of lesser importance, and in reverse chronology. So that means the things that have happened to you that you've got most recently are most likely to be cleared up the quickest, and the things you've been struggling with for longest will take longer. It stands to reason, really.
100%.
So, you know, when things move about the body, it doesn't necessarily mean, I mean, if you're not used to tracking those things, you might think something's got worse. And I've seen it a lot in practice,
I
but
hear it all the time.
usually it's something that's moving through the body to be healed. So yeah, it's been really interesting. What there is a certain amount of dysbiosis with any level of hypermobility spectrum disorder. So it's about also interesting to me. I was saying in the chat, because I've been calling various customers to see how they were getting on, and you know, the appreciation of the freebies, and then you think yourself, oh right, interesting, because dysbiosis, there you go, you've got your probiotic, so that's going to really help. You know, then you need the cell wall integrity. So the cells in the gut itself need to have to have good integrity, so that your omega-3s come in. You know, Nrf2 was amazing for me anyway, and I've had hypermobility all my life. So, you know, the reducing of pain, the reducing of inflammation, those kinds of things, you know, and there can be a certain level of anxiety with it as well. And it can actually lead into chronic pain disorders. So where you've got something that's reducing inflammation and actually helping somebody to manage stress, as we see with Nrf1, particularly Nrf2, I mean, particularly, that's just great. So, I mean, I've seen people in the group sort of going, oh, my clients can't afford all the products. Well, you know, I've got that same issue. I'm like, you know, I have budgetary constraints like most people do. But I know from the work I do is the body likes to be surprised. So it's like if you keep hitting something on the same spot over and over again, you'll eventually numb it out. And there's something called deregulation, and you can actually cause something to go the opposite way. So you do need to keep cycling with things. So having the different, I do this all the time with LV products. I'll go and do, you know, the IC Bright 1 month alongside the Nrf2, and then I'll be doing that with the collagen, because I'm very keen to see what the collagen is going to do for me, because I've got a big need. So I think cycling is a really good idea, and the products are already really good. And I mean, I can't believe I'm a practitioner. I've done this sort of work for people for many years, but I've not really paid that much attention to myself. Isn't it bizarre? So, you know, and I'm like, how did I miss this? Obviously, I need to pay more attention to all of this, and I'm learning a lot about it at the moment. So it is a, you know, I've been working with my craniosacral therapist and the dentist, who's her husband, actually, a holistic dentist in Scotland, and everything hangs off the jaw. I had orthodontic treatment when I was a child. They took too many teeth out on one side and not enough, you know, they were lopsided me. So my jaw is slightly squee-whiff. And I saw this in 3 dimensions when he scanned my jaw, and it's like, oh my God, I can really see it. You know, somebody who's used to looking for these things will see one eye slightly bigger than the other, and you just think, well, everybody's slightly wonky, aren't they? But that's what happened to me. And then it's affected, you know, the muscles at the back of the condyle here, the muscle underneath the tongue, and that accesses C1 and C2 in the spine, and then everything shakes down from there. So, you know, it's fascinating. But I think these products are really very, very pertinent. So I think that's probably it really from me. Fantastic. Can't think there's anything else. I mean, my sleep's great. My what else did I was going to tell you? My strength is improving. I'm doing HIIT training, not every morning because I'm still too fragile really to do that, but I'm doing it regularly, and I can feel my recovery is improving and getting quicker, and I'm getting stronger. And when I saw my therapist today, she was like, I can tell the tone has changed. And she's got a hypermobile husband, so he's going to be on the collagen soon as well. It's quite you know, and she said
Oh,
to
wow.
me, she's been doing this work for 30, 40, 35 years or something. She said when she first started, it was 1 in 50 that she was seeing of hypermobile clients. And now she's seeing 1 in 3. And the reason
Oh,
that
yeah.
they're
It's
both
like,
giving
it's
is this,
crazy.
the dysbiosis. It's to do with the gut. It's to do with the gut and the glyphosate coming through the food. It's a constant microdose. If you're eating non-organic bread and baked ware, you're going to be giving a microdose of glyphosate into the gut, which, apart from it being a neurotransmitter disruptor, an endocrine disruptor, it's also an antibiotic. So you're wrecking the microbiome.
Yeah.
And there's all this,
Yeah.
you know, repopulation that needs to go on. It's all about the gut. And if you can get children
Yeah.
sorted early, you don't get what I'm now facing, which if I don't turn it round, there are more horrors on the horizon. So, you know, it's a big deal.
Oh my goodness, I
Yeah.
can't even begin
There's
to think
big
what the next
market.
20 years is going to be about. Yeah. And also we do such a good job. We have the collagen, we have the probiotic, we have Nrf2. Like, that together is such a powerful combination for gut health.
But also, you know, the
Kasha was
lutein
speaking about last week
in the IC Bright.
in like,
You've
right, that helps
you've
too.
got lutein in it, yeah. So our lutein, the levels of lutein in our IC Bright, when you look across different products, is high. It's a good amount that you get with the IC
Oh,
Bright.
really?
And the lutein has something to do with the attachments, so of the ligaments and tendons. So again, even
Yeah.
and you know, I've got blue sclerotics, you know, sclera in the eyes. So the white parts of my eyes are pale blue, and that's because the collagen isn't very thick. So then you start to piece
Oh,
together this whole picture and go,
yeah.
oh right, I get it. I'm clumsy. I'm really clumsy. That's because of this. I just thought, you know,
Yeah.
fascinating. Anyway, I've said enough, I'm
Amazing.
sure.
Right, we need to move on just for the sake of time, Jeanette, but that was great, great advice. Can I just say one thing before we move on to Lizzie? Is that I see this same reaction come up in the skincare. So when people use the skincare and they have a reaction, this is often a similar process in that it's quite active and it's doing quite a lot, but the healing is often, and we were chatting about this in a side group with Marion and Martina the other day in a little WhatsApp chat. You know, the healing that takes place is often healing that needs to come from within. And so it might be that the collagen and the Nrf2 is going to strengthen them up so that the ability to tolerate the skincare is going to be a lot better. But also that's why I'm always like, well, try not to quit completely. Maybe wait till your skin gets better and then reduce the usage and come back onto it really slowly, because in general it's going to have a good effect long term. But the general response to people when they have a reaction like that is, oh, I've been allergic to it, or oh, it's not good for me. And it's not always the case, especially with something that doesn't have colors, fragrance, you know, preservatives in it, and a lot more activity. It's usually a bit too active. And especially people that need a cleanse, liver cleanse, it all comes out in the skin, doesn't it? So
yeah.
All right,
you've
thank
got the
you very
toning
much. So just
effect.
remember that's the
Sorry. I was talking. No, I was just going to say you got the toning effect of the liver in the Nrf2 as well with the milk thistle. So you know that's all very helpful.
Exactly.
Well, right, I'm shutting up now. I'm mooting.
Yeah. All right, Liz. Oh, we're already at 8:30. I can't believe it. We've so much to go through this evening. We might have to cut it back a bit. So we're just briefly share with us. Oh, you did a great job, Jeanette, of also explaining what you do, but share with us a little bit about what you do outside of Life Vantage and how you became a consultant and how the products have helped you, because I know you also are somebody who has struggled with the same condition, EDS.
Yeah, so I'm a massage therapist. I do like energy work as well, and I've been doing that for about 7 years. I became a consultant because the Nrf2, just the Nrf2 on its own had like completely changed my life. You know, it was like I went from not being able to walk properly in the morning, you know, and like having mild like subluxations in my joints overnight, just like turning in bed. I echo a lot of what Jeanette was saying, you know, it's like without going over it and over it, but it's like, you know, you can just be reaching for something and your neck will, you know, you won't be able to move it. And this lasts for weeks. My thumbs and that would come out when I was massaging people, so I wouldn't be able to work for, you know, I'd have to cancel everyone. And then, so it was affecting what I could do. But when Nrf2 came along and Patricia's vast knowledge and my never-ending questions, I just gave it a bash and very quickly noticed huge improvements in the inflammation in my body that was causing like it's quite similar to fibromyalgia and certain types of arthritis. It's in that same kind of bracket. But certainly I was having a lot of issues with neuralgia, jaw dislocations as well, headaches, anxiety, just not being able to move my joints and my body very well because of these things, you know. So I don't know what life was like. It's been like 2 years since that happened, and it's just Nrf2, just like I think 4 or 5 months in was like that's when I knew that something had completely changed for me. Like my life.
So what difference did you see then? So about 4 or 5 months you noticed. What type of things did you start to see?
Well, basically improvement in how my joints were able to support themselves. So like usual like over flexing connective tissue I would like my brain would be able to acknowledge more of when it would stop, but you know, where it needed to stop. Whereas before
Wow.
like overflex and then cause so many spasms, I would have to have lots of painkillers and different things. But it's like I would be more, I could tell where my joints were, you know, like more of an awareness, a strength that I didn't have before as well. You know, like my thumbs and I've got splints that I would wear and, you know, to go to bed. Otherwise my hands would just like bend, like completely bend. And then I wouldn't be able to feel my hand, have to shake them awake and stuff. You know? But then that would cause nerve issues and again, sciatica, you know, down a lot of your body. It starts from your head and works all the way down to your toes, you know, where you couldn't actually be on your feet for very long without having that weakness. So that all went. The broken glass in the bloodstream went. I mean, this is pretty quick. It was like built up over the first few months, and then just each month has just got better. I'm now doing Pilates, advanced Pilates, and I never would be able to do anything like that before. Yoga killed me, you know. So yeah, Pilates, I've been pulling weights. I don't cancel anyone anymore. I mean, the neuralgia is almost like I can't remember last time I had the, you know, usually I get a little cut or something, and then it would be like this, you know, ricochet through my whole body. I wouldn't be able to swallow without, you know, like it's like somebody's jabbing your ear with a pair of scissors, you know, a broken glass in your.
Is it like neuropathy pain?
Yeah, I would say so. It's just would travel very quickly. You wouldn't be able to like almost like the headaches. You wouldn't be able to look at any sunlight as well. It's like it falls into all many, you know, so many different boxes that, you know, if you were to go to the doctor and you had something that'd be like, oh, that's this 10 symptoms now. Oh, that's this 15 symptoms now. Oh, wait a minute, it's changed now. I'm back to those 8 symptoms plus these 5. You know, it's like, you know, at what point?
Yeah.
I mean, I went to the doctor.
It's a bit like, so fibromyalgia is very similar as well, isn't it? And also getting a diagnosis must be a nightmare for something like that.
Because they just treat you all separately, treat all the symptoms separately. They're not really interested in it as a syndrome. You know, they're only interested in, all right, okay, pain relief, okay, something for the nerve pain, okay, something for the headache, something for. So I gave up.
That's not helping you get better though. It's just numbing the symptoms, which just get louder and louder and louder, don't they?
I don't take anything from the doctors anymore. That's how good Nrf2 has been for me.
Wow.
Yeah, it's been amazing.
I have to tell you, touch wood. I couldn't tell you the last time I went to the doctors. I know the last time I did, and I had a very severe kidney infection. And I honestly believe it's because I was flushing a kidney stone, a small kidney stone. I do believe that's what happened. And it's probably 8 years ago since I've been to the doctors. Literally, I've not been for a very, very, very long time for anything. Amazing. So great to hear this. Guys, Liz, have you shared your story in the My Life Vantage story group?
No, I don't know why.
Oh my gosh, you must.
Yeah.
Patricia, you're in charge of making sure that happens. Because, and I'll tell you why, there are so many people like you looking for answers. That chat that I started, there's people in there asking, has anybody else had this? Have you seen results? Has anybody seen any benefits? So guys, you must go to the My Life Vantage story group and share your results with others, because it's the only way they get to see someone else and how it's worked for them, and it gives them the confidence then to give it a go. So thanks so much for sharing. I have to move on just because of time, because we've taken quite a bit of chunk out of this evening, but sharing these stories are really important, because I know we talk a lot about collagen, but let's not forget how amazing Protandim is, and it's held us up for the last 8 years, in fairness. And because it is such an incredible product, and when you hear it's changed somebody's quality of life that much, like, I forget sometimes how mind blown I used to be hearing stories like this every single week. So thanks so much, guys, for sharing. I'm sure it's useful for everybody else to be able to support other people and have a bit more confidence saying, hey, I heard some people talk about that. You need to give this a go. So yeah, fantastic.